Assalamualaikum warahmatullahi wabarakatuh. Today I would like to present about burnout among frontliners workers during pandemic of COVID-19. What is pandemic? CDC defined pandemic as a disease that has spread over several countries or continents, usually affecting many people, while WHO defined pandemic as a worldwide spread of a new disease. A study by Q et al. Listed the key features of pandemic. And there are 6 key features of pandemic. So first, wide geographic extension. Second, the disease in movement or transmission. Third, novelty. Fourth, the severity of the disease. Fifth, the high attack and explosiveness. And the last one is the minimal population immunity. First criteria with the wide geographic extension. A pandemic is a disease that spread and covered over a large geographic area. For example, geographic spread of influenza. Influenza outbreak back at 2009 spread covered almost all the American and it spread very fast. Okay. And then second is the disease movement or transmission. So disease movement or transmission is the person-to-person disease transmission, such as airborne, waterborne, direct contact, and others. Like for COVID-19 outbreak, which is a current pandemic, it is transmitted through the airborne and direct contact. The third features is the novelty. Novelty is actually a quality of being new and unusual. So a pandemic disease is a new disease or disease that least correlates with existing disease. So for example, Black Death is a pandemic. It's a pandemic back at occurring in the Afro-Eurasia back in 1346 to 53. So it's almost 10 years of pandemic. No resolved treatment because this is a new disease, so it's difficult for them to create a vaccine or any treatment for the Black Death. Okay, the next is the severity. So pandemic is a disease that are more severe disease with high mortality rates. Okay, for example, Ebola outbreak back at 2014 shows that the total death are almost 50% of the total cases of Ebola. So it shows a very high mortality rates. Next is the high attack and explosiveness. A disease that widespread but not explosive was not classified as a pandemic. So pandemic is a more explosive with high attack rate such as influenza and cholera. Dr. Legros, who is a WHO cholera team lead, stated that vaccination will not solve the cholera problem, but only buy us some time. Unless we can meet and long-term water and sanitation interventions, cholera is going to reappear as soon as immunity to the vaccine wanes. There are no shortcuts. Okay. The last one is the minimal population immunity. So immunity of a population against a disease, a pandemic disease, was minimal, which later caused highly spread across the population. So a study published in the April 7, 2020 stated that regarding the immunity of the COVID-19, stated that there are 3 stages of towards herd immunity. The first, there is a novel pathogen, is a new pathogen introduced into the community. So there is still no immunity and no vaccine yet. The second one is those who recover and those who receive a vaccine develop immunity. So at least for a period of time. With the coronavirus, it is not known how long, but now currently we already have some proven vaccine and we are actually trying to test it. The last one, to create the herd immunity takes hold when the pathogen can find new hosts and stop spreading. So that happens once a sufficient portion of the community is immune for this virus, estimated range from 55 to 82%. Okay, there are so many effects of pandemic COVID-19, especially in Malaysia. So they are affecting few industry. First, the stock market industry. So in Malaysia, COVID-19 affect the performance of almost all sectors in Malaysian stock market. So people are not out to buying. So there's a loss of there's more jobless people. So less demands and affect the stock market of Malaysia. Second one is the tourism industry. So COVID-19 also affect our tourism industry, such as there are remarkable reduced number of tourists. So hotel business and airline business had a loss of revenue and facing a high risk of bankruptcy for airline business. Okay, for micro entrepreneurs, okay, the micro entrepreneurs will have loss of daily income, so they need alternative approach to maintain their operation, like adopting medical, social promotion, and online business to survive. Okay, aquaculture industry. So disruption of demands and supply chains in the seafood decision during this pandemic COVID-19. Okay, pandemic COVID-19 also affect the education industry. So 20.4, 6.6, and 2.8% of the experience minimal to moderate, marked to severe and most extreme level of anxiety among university students. So the anxiety is actually resulted from the financial constraint, remote online learning, academic performance, and their future career development. Okay, the last one is the health industry, especially among our frontliners. So there is a prominent impacts of anxiety, burnout, and depression among our frontliners.
Hi, my name is NURSALBIYAH. I will present about the prevalence of burnout among the frontliner. COVID-19 pandemic globally has caused additional health problems, including stress, anxiety, depressive symptoms, insomnia, denial, anger, and also fear. The symptoms of burnout has been reported among all the population. It has been affected the whole world community regardless of continents. For example, in Asia, including China, Indonesia, Malaysia, Nepal, and Iran. In Europe, including Turkey, Spain, Italy, and Denmark. In Africa, in South America, and in North America as well. After being shortlisted, there are many symptoms of burnout reported from the studies and journals. The highest symptoms of burnout is physiological stress, which remarked 34.43%. Other symptoms including anxiety, which represent 23.2%, and depression, 22.8%, which is among higher burnout symptoms in populations as well. Next higher percentage followed by stress, 8.1%, and post-traumatic stress disorder, 7%. Another study also reported other symptoms including insomnia and fear. There are many factors contributing to burnout among the frontliner. One of the factors is direct exposure to COVID-19 patients, in which they are directly in the involvement of assessing and treating the COVID-19 patient. Apart from that, working as healthcare has caused burnout too, as they have to work in prolonged hours at workstation. Most studies reported that female frontliners are more affected compared to male, and younger population which age less than 40 years old. This may be due to hard responsibility they have in family as well. Those population who suffer from chronic illness also reported burnout. Other than that, the employee and students has reported burnout as they feel unsure with their future, or the need that may need to involve in the management of COVID-19 as well. Some are reported they feel burnt out, especially those family members who is working as healthcare or family members who's been affected by the COVID-19. This has affected their personal relationship. Most latest news regarding pandemic is being reported by the social media. Too close engagement with social media can also lead to burnout as well. The prevalence of burnout in Malaysia, A previous study done by Chow et al. To 2020 reported that Malaysian frontliner has developed anxiety and depression throughout this pandemic from last year. A few factors has been identified by the Roseline et al. 2021, which including direct involvement in COVID-19 screening and treatment, those frontliner that has medical condition but still need to involve in the COVID-19 management. Some health workers may not receive enough support at the workplace. Due to uncertainties caused by pandemic, the health worker has increased their workload from time to time. The health worker may develop stressed workplace relationship with other workers, and some may have to face the challenge to balance the work and family relationship. Few symptoms has been observed from study done by Fauzi et al. This is including the exhaustion, the emotional demands such as acute and chronic fatigue, depression, anxiety and stress, opposition with the relaxation experience. When there is increase in work demand, the recovery experience also lower. This has caused the workers to utilize the problem-focused coping in order to deal with those experiences.
Hi, my name is Muhammad IZHAM. Today, I would like to present about the causes of burnout among frontliner and how to solve it. As we know, burnout may lead to a psychological disorder, substance abuse, and suicide. So, in order to solve this problem, it is necessary to identify causes of burnout and proper way to settle it. So there are a few causes of burnout among frontliner. First one is a job stress. During COVID-19 pandemic, frontliner has higher workload. They have to work for a long period. So this may lead to prolonged exposure to COVID-19 patients. So this may lead worried among them being infected. So it causes burnout among them. The second causes of burnout among frontliner is hospital resources. During initial outbreak of COVID-19 pandemic on last year, there is lack of personal protective equipment. Then there also lack of medical resources in order to diagnose, treat and prevent this COVID-19 disease. There also, the third causes is a lack of social support, which is frontliner feeling of being isolated by community. This is due to stigma of community. They think that frontliner may spread the COVID-19 virus. Then the other causes of burnout among frontliner is there is a rapid changes of health policies. There is also conflicting information announcement by authority. There is also reduced income and economic recession. Okay, so how to prevent and reduce burnout among frontliner workers? There is a three method, which is the first one is the individual methods. The frontliner worker need to improve their health literacy by being joyful, participating in physical activity, and having good rest. They also need to have good interaction with their family members. Other than that, starting mindfulness-based stress reduction activity such as meditation and yoga also help to reduce the burnout among the frontliners. Other than that, they need to learn, practice physical, mental, and emotional self-management. The second way is the organization level approach. The organizational may reduce the workload by improve the work schedule, reduce working hour, and set limit of working hour. They also can provide counseling and support system at a workplace, especially for frontliner workers. They also can create healthier and supportive working environment. For example, they may conduct stress coping skill workshop. Then the third method is use of digital technologies. Currently, there is a lot of mental health service provided via mobile application and social media. So this platform can be used for frontliner who are having burnout. They may express their concern through that application and social media. Other than that, they can have connecting via digital communication platform such as WhatsApp, Telegram with colleagues, family and friends, so they may express their concern. Other than that, they can have access to the latest and valid information regarding COVID-19.
Hi, my name is Noraishah binti Omar Othman. I will present about issues in Malaysia. Major issues arising in Malaysian frontliner were burnout, depressive, and anxiety. These three main causes has associated with increasing number of daily positive cases. As presented by my colleagues, limitation of medical equipments, not enough staff, and PPE also become an issue in Malaysia. Therefore, burnout will become depression and anxiety. Research done by Cho et al. In Malaysia, nurses has 38% majority of depressive symptoms compared to others. However, doctors have moderate to severe anxiety, which is 21%, and this is might be because of exhaustion to high workload, and for the nurses is challenging in work balance because they are working mostly in shift. Another issues in Malaysia we can see is high work demands, which is influenced by daily positive cases also, and recently it has keep increasing until now, and most of them also will have fear of feeling being infected by COVID-19. Hence, the risk of spreading to family members also become an issue. Another issues is poor social support from family, society, and non-frontline teams, which is giving impact to them, especially when other people have negative perception perceptions towards frontliners. Okay, and external causes such as financials, work-life balance also giving impact due to unstable economy in Malaysia right now. Next, okay, as an intervention, Malaysians have developed three roles in order to help our frontliner from burnout, which is individual and community, from the organization roles itself, and also from the ministry and government roles. As an intervention, okay, Malaysians, for individual and community, what we can do is to give a support from family members and to have positive social interaction, such as social life, social media interactions, and involved in mindfulness stress activities such as yoga, Pilates, and also sports creatures. Okay, this can help our frontliner from being exhausted and stressed. From the organization rules, The organization itself have to improve work schedules, giving staff breaks and limit hours so that they no need to do overtimes every day without rest, and giving extra hands from outside, such as just now government decided to have a collaboration with private hospitals, which is COVID patient can stay in private hospital is one of the good idea also. And support system such as our My Sejahtera, okay, is one of the support system can help to reduce to trace COVID patients. And another roles is to do psychological support to our staff, such as doing counseling and giving more incentive to our front lines so that they will be happy and feel more appreciated doing their job. And we can see intervention from our ministry and government. They increase the budget for healthcare services, the number of contract staff in government servant, and also the facilities, the equipment for medical purpose, especially to attend COVID patients. And then for the staff, okay, there's a lot of allocation of allowance and incentive for frontlines, and also giving a lot of financial release in order to help people also other than frontliners, so that our staff will be happy to work together. Okay, so as a conclusion, in order to help reducing stress and burnout among frontliners, we should identify the causes and the factors before our frontliner exhausted. Proper interventions and support systems should be implemented as soon as possible in helping all frontliners, so that there will be effectiveness to fight COVID-19. Stay home. That's all from us. Thank you very much.